Red light therapy has been around for a long time, but it recently took the internet by storm, with many people wearing masks, touting it has anti-aging benefits and reduces inflammation. But what does it really do and how does it work? We have Dr. Feras Al Ghazawi, dermatologist at Panorama Wellness Center. He's here to break it all down for us. Good morning to you.
Good morning.
Okay, so first off, explain to all of us here, what is red light therapy all about?
So red light therapy, or sometimes it's called low-level laser therapy, it is the use of red light to stimulate collagen synthesis, promote wound healing, and has few other applications, medical applications in acne treatments and whatnot. This is by using red light energy to penetrate through the skin and produce energy or deliver energy in the form of ATP, and that promotes collagen synthesis and has anti-inflammatory implications.
Okay, so it sounds like you just said to use it to in the healing process of the skin,
Right.
reducing inflammation. I understand that there's the mask right here. You put this on and then you get this therapy with the red light. As I understand it as well, there's like a helmet where you can stimulate the scalp.
That's right.
As well.
That's right.
Once again, how does that work? What does it do when you put this sort of helmet on?
So I have to highlight is that there's so much research that needs to be done. There's the evidence still evolving, and the efficacy and how to optimize these techniques, it's still something under heavy research. In terms of hair growth, what we believe it does, we believe beyond the anti-inflammatory effects, we believe that it prolongs the part of the cycle of hair growth where the hair is alive, and reduces the shedding part.
Okay, so Dr. Ghazawi, are there any dangers or any cautionary advice that you have for anyone using red light therapy?
Right. So first, it's a generally safe treatment, especially for those over-the-counter products, generally speaking. However, safe doesn't mean necessarily very effective. So there are certain, you have to follow the rules and you have to follow the timing.
Can you overuse this? Can you put the
Right.
mask on? Maybe you fall asleep and you have it on. And
Exactly.
is that overuse? Is there that risk of that happening?
So that's a risk for sure.
Okay.
It could result in skin irritation,
Okay.
inflammation. So one has to be careful, and I have to emphasize, please use Health Canada approved devices.
Because there are many different red light devices out there. So you got to make sure that it's Health Canada approved.
Exactly, 100%.
Okay, and you do that. Okay, and does it, in your opinion, as a dermatologist, is there any efficacy to this mask? Does it work?
Well, it depends on the indication, it depends on the device, and also if it's over-the-counter or medical grade in my clinic, for example, or whatnot. There is some evidence, but one has to be a little bit cautious. And depending on the application for it, it's not necessarily the most efficacious way. For example, for deep wrinkles, for whatnot, there are better modalities. This does not replace laser treatment, Botox, peels and whatnot. So this is an adjuvant and needs to be used for very long before one can see reasonable efficacy.
And Dr. Ghazawi, you were saying that there also needs to be further studies, right? It's not fully studied. There hasn't been that kind of results that we can go, absolutely, this is what it does.
Yes,
but so far it doesn't hurt, is what you're saying.
Well, I mean, it depends, again, it's not necessarily how to use it.
Okay.
But there is still a long way to go. This is not, very, it's still in a juvenile age.
Okay, still in its infancy, if you will.
Right.
I want to just leave our viewers with something here who are, those folks who are thinking about purchasing a mask and using this red light therapy. In your opinion, go for it or don't?
It depends on many things, the budget, if you can afford it, if you can use it safely, if you're going to use it from a reputable source, sure, but I'm not promising great results with
Okay.
it. Yet it's still an infancy stage, I would say.
Still infancy.
Yeah.
Probably best to check with your dermatologist. Is what you're
100%.
saying.
Could
There
not
you
agree
go.
anymore.
There you go. Thank you very much,
course.
Dr. Feras Ghazawi. Thank you so much for clearing this up here. Red light therapy. Now we know. Thank you.